Hello everyone and welcome to my Home and Away news channel. I hope everyone is having a wonderful day. Before we begin, please hit the subscribe button and give this video a thumbs up. 1000 Elb Sisters did the show pay for Tammy Slaton's surgery. 1000 Elb Sisters star Tammy Slaton has been celebrating her excess skin removal surgery. She's been participating in meet and greet events with her siblings, showing off her stunning transformation. Tammy has dropped over 500 pounds since getting her bariatric surgery in 2022. The latest season featured one of the final steps of her journey, which is getting rid of her excess skin. However, many are curious about who paid for the operation. Keep reading to see the discussion. 1000 Elb Sisters. Tammy Slaton opens up about surgery. Tammy previously participated in an interview where she opened up about finally getting her excess skin removal surgery. According to the 1000 Elb Sisters star, after 6 years and dropping over 500 pounds, she finally achieved one of her biggest goals. She was overwhelmed with excitement, adding that she worked hard to qualify. Tammy was initially rejected after it was discovered that her protein intake was low, which could become an issue for her recovery. She was also told to get rid of her vape. Tammy also admitted that it was a scary moment for her, as she'd wake up looking like a different person. Some 1000 Elb Sisters fans on social media discussed who paid for Tammy Slaton's surgery. There have been speculations that TLC's My 600 Elb Life patients paid for their own surgeries, and they're curious if Tammy got the same treatment. However, several commenters mentioned that surgeons and medical facilities would offer free service just to be on TV, as it greatly promotes their names. Tammy and her siblings never talked about who was paying for their surgeries. But considering the show's massive success, some believe that TLC is also covering the operations. Another social media thread also discovered that there's an upcoming episode for 1000 Elb Sisters Season 7 after TLC announced that the last episode was the finale. It was a huge surprise to many fans, as there are still a lot of stories to be covered, including Amy's wedding journey with Brian. But some fans think the upcoming episode will just be a recap of everything that has happened throughout the season to prepare the viewers for another possible season. Tammy Slaton's dramatic health journey has kept fans on the edge of their seats from the moment she first opened up about her struggles with her weight on 1000 Elb Sisters. The show is more than just a reality TV series. It's a raw, intimate look into the Slaton sisters' lives as they navigate health struggles, relationship dramas, and a quest for transformation. One question that frequently pops up in conversations, on social media, in forums, and amongst fans, is who exactly covers the cost of these dramatic surgeries and health procedures. Did the network pay for Tammy's weight loss surgery, or were there hidden financial contributors? Today, we're going to dissect this in detail. From production incentives and healthcare plans to the role of health insurance and TLC's responsibilities, in a creative, insightful journey into the financial side of 1000 Elb Sisters. The rising fame of Tammy Slaton. Tammy Slaton first came into the public eye alongside her sister Amy Slaton in the debut season of 1000 Elb Sisters in 2020. The two sisters started their weight loss journeys together, battling health issues, food addiction, and deep-rooted habits, all while allowing TLC's cameras into their daily lives. As the show grew in popularity, fans fell in love with their raw honesty and ability to connect with an audience battling their own struggles. Naturally, this meant greater viewership, which in turn meant greater revenue for the network. But this rise in fame also raised questions about fairness, financial incentives, and the actual cost of the dramatic health procedures we saw on TV. Did the network pay? Some fans have speculated that TLC may have covered Tammy's surgery considering the dramatic procedure was a key storyline for the show and a huge viewership draw. From a production standpoint, this makes perfect sense. Following a person's weight loss journey through a risky procedure is powerful content. Reality shows frequently absorb certain expenses, especially when a procedure is a dramatic turning point in a character's story, to keep the narrative moving forward. There's a long-standing precedent for this in the industry. For example, shows like My 600 Life often pay for the patient's initial appointment, their relocation, and their subsequent bariatric procedure. Insurance, Medicare, and Medicaid, the unseen players. Meanwhile, it's not a given that the network covers all the expenses. Sometimes healthcare providers, insurers, or government programs shoulder a large portion of the cost. Tammy Slaton's health struggles were well documented, from diabetes to high blood pressure, conditions that often make her eligible for health coverage through Medicare or Medicaid. Furthermore, in the state of Kentucky, where Tammy lives, Medicaid expansion under the Affordable Care Act, ACA, has made healthcare more accessible for low-income adults. This means Tammy may have gotten her surgery approved under her health coverage, reducing the financial pressure on her and her family. The surgical procedure, gastric bypass. Weight loss surgery, particularly gastric bypass, is a well-established procedure for people with a BMI over 40 or over 35 with health complications, which certainly applied to Tammy. The procedure typically involves shrinking the stomach and rerouting the small intestine to help the patient absorb less food and calories. Such a procedure can range from $20,000 to $30,000 or more, depending on the hospital, the surgeon, and the patient's healthcare coverage. If Tammy was covered by Medicaid, a large portion of this could be paid directly by her healthcare plan. Why the question becomes complicated? This is where the story gets messy. There's a huge amount of overlapping financial responsibilities in cases like Tammy's. The network might pay for expenses related directly to filming, travel, accommodations, specialized diet plans, while healthcare insurers cover the actual surgery and follow-up care. Meanwhile, Tammy might have secondary health coverage through Medicare or a private policy, adding another layer to the financial picture. Furthermore, the surgeons in hospitals sometimes reduce their fees in exchange for publicity. Participating in a popular TV show can be a huge boost for a doctor's reputation, which further cuts the final cost. The network benefit: rising viewership and profits. From a business perspective, 1000 Sisters benefits directly from dramatic health journeys. The more dramatic the transformation, the more viewership it draws. So it's reasonable to say TLC has a clear incentive to support Tammy's healthcare, whether directly or by helping her navigate health coverage in order to keep the story alive. The show's popularity brings in substantial ad revenue. The more people watch, the more companies pay to advertise their products during the episode. So investing in a dramatic health story makes perfect financial sense for the network. The Slaton family's benefit: a second chance at life. For Tammy, this wasn't about profits. It was about survival. Without this procedure, health complications stemming from her obesity were threatening her life. She faced reduced mobility, trouble breathing, diabetes complications, and a dramatic reduction in her life expectancy. Weight loss surgery offered her something profoundly valuable: a chance to pursue health, happiness, and independence. Whether it was the network, healthcare insurers, or Tammy herself paying the final bills, the result was the opportunity for her to live a more normal and less restrictive life. Summary: who actually paid? So who paid for Tammy Slaton's surgery? The answer isn't black and white. It's a blend of contributors. The network likely covered some expenses related to production and lifestyle accommodations. Insurance, whether Medicare or Medicaid, probably absorbs the majority of the actual healthcare costs. Furthermore, there may have been financial incentives for surgeons and hospitals to perform the procedure, given the extensive media coverage. Ultimately, the combination of resources made it possible for Tammy to undergo a dramatic, life-changing procedure, a procedure that might otherwise have been prohibitively expensive for her. Final thoughts: why it matters. Tammy's story highlights a unique convergence of healthcare policy, reality television, and human perseverance. It shows us how financial resources can come together to enable dramatic health transformation, not just for the person directly involved, but for their family, their community, and for viewers who find hope and inspiration in their journey. This blend of funding sources underscores a larger conversation about healthcare in America. Access to life-saving procedures shouldn't be a privilege for the few. It should be a universal opportunity. Tammy's journey, while dramatic and unconventional, illustrates the power of collaboration, insurers, networks, hospitals, and individuals to profoundly change a person's future.